Trying to decide if I should give you the one on small ruminant overview,
I think you
which
should.
covers everything. So I'll think about that one, because if I do it, it'll be on the exam. So I'll think about giving it to you after the exam.
That isn't it.
That better? Yeah. All these people cheat.
You know, like an FYI.
For those, what?
Like an FYI kind of thing.
Oh, I thought you said meth lab. I was like,
What's on your mind?
okay, I think I can hear you now. No. Okay, remember, malignant edema in pigs especially can resemble or is very similar to black leg. Okay. Now, things you need to remember, exotoxins result in excessive inflammation locally. So you get edema, necrosis, and gangrene. This is all malignant edema. Risk factors in horses is any type of IM injection or sub-Q injection, and sometimes even intradermal injections. Sheep is usually associated with shearing, docking, and lambing. Docking tails. And in cattle, it's a traumatic parturition. When would a traumatic parturition occur? RDA. RDA, parturition. Now that might happen after parturition, but when would a traumatic parturition occur? Who's usually present?
Farmer.
Either the farmer or one of us. In other words, we're extracting the fetus from the cow or the animal, and that's when it would happen, or during castration. Okay, septic can also cause a disease condition in sheep. This usually happens in the colder states or states that have colder weather, and it's associated with those animals that are turned out before they're kept up at night, and then they're turned out early in the morning. So you see it happening in Michigan, Colorado, Minnesota, any places where there's a lot of cold weather. Alaska, Canada, Hawaii, nah. But any place where there's going to be a heavy frost or snow. And it affects the abomasum. It's called Braxy. How does it, how does it occur? There's nothing in the books that say it all in one place, but they say a little bit everywhere. And basically what these guys do is on an empty stomach, it's like taking a lot of aspirin, people who are sensitive to aspirin or susceptible to aspirin. You take a lot of aspirin on an empty stomach. What happens? It tears up your lining. So with these guys, when they turn out without having eaten anything, they have an empty stomach or rumen. So they eat all this frosted, covered vegetation or even feed. It cools down the rumen. Abomasum's right next door. Some of that cold stuff enters into the abomasum, causes alteration in the abomasum mucosa. You got spores everywhere anyway, and the spores are probably already in the stomach. And so these spores can enter into the tissue. And they rapidly replicate, releasing toxins. You go out there 2 hours later, well not 2 hours later, about 6 or 12 hours later, and the animal's dead. Or you find them dead, like this. It can be a sudden onset, or if you catch it right before they die, you'll see it anorectic. They're not really wanting to eat. They're severely depressed. They're lagging behind the herd or flock in this instance. And if you go to work them up, do a physical exam, you'll find out that they are febrile, and they can get as high as 107. They may or may not have bloat. And then death occurs within hours. What would you have, if you found some sheep, well, actually, you can't use that one, never mind. I was trying to fit anthrax in there, but it ain't gonna work. Diagnosis, extremely difficult, unless You do an immediate necropsy, especially if they're freshly dead or if it's still cold out. Do a necropsy before bloat sets in, and take smears. Ideally from the surface, the cut surface of the abomasum, but you can actually take smears of the mucosa within the rumen and sometimes in the GI tract. And what you're looking for is an abundant number of Clostridial bacteria. And then we submit stuff to culture. There is no treatment. Why not? Why is there no treatment, Dr. Kopich? Well, you're going in there, the animal, this is an acute fatal disease. You go out there, you grab the animal, he's febrile, you start the treatment, they die. So you can attempt to treat these guys. You might get lucky, because no animal reads the book. But for the most part, it's fatal, even if you institute treatment. You might be able to carry them on for a few days, but they eventually die. But there's always that 1% that you manage to catch. So the biggest thing on this is prevention and control. The first thing is management. Even if you don't vaccinate these guys, feed them before they go out. And if you're going to keep them, and if you're going to, if you're in an area where there's a lot of snow and heavy frost, then bring them up, but make sure that they have plenty of feed, primarily roughage, hay, so that they can fill up on them. But the biggest thing, if you're in areas where it snows, but it's not always there, like in Alaska, you got 6 months of snow, vaccinate these guys. And I would recommend, and it's recommended that you vaccinate these animals anyway. But vaccinate them. And then if you have any animals that died from braxy, dispose of the carcasses, either by deeply burying them in a lime pit or burning them immediately. Don't let the animals or vermin come in there, grab it, and drag it all over the place. Any questions? That was septicum. So you see all the diseases septicum can cause, depending on the species. Make a chart. Make it easier. Any questions? Shall we go to the next one? Oh, this is just so wonderful. Okay, you arrive at a 60 cattle herd that has 60 head. People are just getting started. And you've got 2 that were found dead. The owner found them dead this morning. He's distraught. Owner states the animals were found about 3 days ago. One started favoring his rear leg about 24 hours ago, and both were found dead misbehaving. There's no history of vaccination at all. Doc, I'm trying to save some money. I ain't got that much money, so I put it all in buying these animals. And another cow, as you go out and look through the herd and everything, you find another cow that has this lesion. Tentative diagnosis. Are you sure you seen black leg look like that? Okay, in other words, come up with differential. Black leg would be one. What else could it be? You see an animal looking like that. Could have been attacked by a wild animal. What else? Trauma, some type of trauma. Maybe try to jump a fence or squeeze through something and rip the hide off of it. But you still have to look at them and consider them well, let's see how you put it. Assume or consider this animal to have the same condition that the other 2 had. The 2 dead ones, just lump them all together until you sort it out. Okay, if it turns out he doesn't, then great. Okay, blackleg. It is a highly fatal disease of cattle and sheep. However, it can occur in any animal. I saw a horse that had blackleg. It was horrible. It was devastating. Brought me to tears. But anyway, commonly affects the heavy muscle, but it can affect any muscle. Sometimes it will affect the muscle and it will be deep in the muscles or in muscles that are deeper within the body. And these animals are found dead. And they have no And you won't find it until you open them up. Assume blackleg. Assume those things. Acute death, lightning strike, anthrax, blackleg, enterotoxemia, something. Get your differential list together. There are vaccines and toxoids, or vaccines that are available. Okay? And they always come in combination. I always give them. So you'll have clostridial vaccines, or vaccines that have several clostridia in there. Antigens. Okay, how you're going to diagnose it is one, you're going to take stains of any of the muscle that you see. The muscle's going to be kind of dark, bubbly, spongy looking. I'll show you some pictures of it. It's really cool. Or you can do FA, fluorescent antibody stains. That's available in some labs. Don't know which ones, you have to call them, and they just ask them, can you check for blackleg? Serology is available, but I got a list of all this stuff. I'm just kind of throwing that all out there as I see these slides. Okay? Emphysematous, what does that mean? Bubbling. When you put your hands on it, it's like crunching up cellophane paper. Okay? Or snap, crackle, pop, some people say. How does it occur? Well, clostridial spores are everywhere. They all look alike until you ingest them. They get absorbed through the GI mucosa. They enter into the bloodstream. They lodge everywhere within the host. And they remain there dormant until the anaerobic conditions, the appropriate anaerobic conditions are set in place. It can be trauma, it can be iatrogenic, maybe they bruise themselves, and sometimes it's spontaneous. It could be an infarct through a blood clot or whatever. But anyway, once that happens, those anaerobic conditions set up, then these seed or these spores germinate, become vegetative cells. These cells start to grow and they release toxins wherever they're located. Usually seen in animals that are well fed. These are the best animals, and this is where you have to remember to do what to your owners. You go out there, the animal's dead, you turn to your owner, says this animal's gone, there's only one leg that's swollen, and the owner's looking at it like, that's my best animal, doc. What are you going to tell them? You're going to die. Okay? You're going to die. Whatever. But anyway. It's usually the young animals, however, it's not limited to the young animals. It can be in any animal that is immune suppressed. So, can it happen in young babies, neonates? Yes, it can, especially if the owner previously had animals die from blackleg. He left the carcasses out there. It seeded the whole pasture. The animal was born in one of the spots where these carcasses had decomposed, and he picks up the anthrax spore. How does he pick up the anthrax spore? He could ingest it, or he could aspirate it, or newborn baby. Contact, yeah, but contact suckling, but contact baby in and of itself hasn't gotten up yet. He hit the ground, bam, umbilicus. Thank you. Boy, I like trolling for fish, but hey. Okay, anyway. All right, usually it's a sudden death, but these guys will have a marked lameness. And in horses, I've seen one horse, we weren't sure quite what it was. He came up lame, he was about a 2-year-old. Came up lame, he was on a study that we were doing with, what was that stuff? Omeprazole. But anyway, went in there, checked the animals every day, went in there, but had just left. Wait, I gotta check to see if that's my mom. Nope. Okay, if it's mom, I have to step out, okay? You'll get one set of parents. Anyway. Otherwise she'll fuss at me. What was that? Oh, okay. Had this horse in there, came in, looked at them, they're doing fine. I'm driving back to work, which is like 10 miles away. we get him outside, check his leg, and it's hot. And every time we touch the leg, the horse, yells out, he cries out, his eyes are rolling in his head. He's trying to bite anything and everything that's there. We finally get him under control, basically knock him down. And during that time, it took us all, 30, 40 minutes? His leg is swollen even more. He's in excruciating pain. Long story short, we started treatment with sank a catheter, put in IV penicillin, anti-inflammatories. He was getting ready to start fluids, and he started having problems breathing, so we put him down. Opened up the leg, and it was dark, discolored, and full of gas. Black leg. When I took it, when we sent it in, sent it into the state diagnostic lab, which was right next door, he looked at me and was like, only you would bring in that one disease outside the box. But it was a good case, and he even admitted that. So, Mark's lameness, and it happens quickly and in a hurry. It is acutely progressive. It just spreads. These guys will go down, they're unable to rise, and if they stay alive long enough, when you palpate that leg again, you'll find out now it's cold to the touch, but it's still emphysematous. Shortly after that, they're dead within 24, 48 hours. If you find them out in the pasture, usually the affected leg is found in the upward position. You can see in this picture, compare the two legs, which one's affected? The top one. And how can you tell? It's affected. It's swollen, extreme swelling. And it's in the upper portion of the leg where all the heavy muscles are. Okay, so the upper part of the leg. But those animals that you don't find these obvious swellings and this obvious heat, crepitance and stuff, when you start opening them up, you'll find out that you'll find these lesions in the tongue, in the diaphragm, heart, along the neck, maybe anywhere. Because remember, the spores don't care where they lodge. They're just going to get into the bloodstream and go wherever. What other infectious disease could this be? Let's say it was a pig. Malignant edema. Yeah. Oh, you remember that question from the other one. So, differentials would be malignant edema. Enterotoxemia can sometimes present like this. Cellulitis, that would be a very severe cellulitis. Some type of bacterial infection within the muscle, so a myositis. Could be a broken leg. Because if you break that femur, all that blood gets into that tissue and it swells up just like this. The only problem is if it's a broken leg, the animal's still going to be alive, but in pain and shortly going into shock before it dies. It could be a severe abscess or a very large abscess. It could be a tumor. It could be a snake bite, depending on where you're at. Okay? Question? Okay. Yeah.
I may have missed it, but what is the reasoning of it all typically attacking like the best of the herd? Like if they're the well-fed, you think they have a better immune system?
No. They think the best of the herd, okay, usually when they say the best of the herd, those are those young ones that are growing rapid, putting on that weight. Okay, they're stressed because of the rapid growth that they're undergoing. So their immune system is really compromised. Okay? Especially if they're not vaccinated. Everybody get that? Rapidly growing animals that are on a high plane of nutrition. Stressed out, immune system, okay, black leg, and other things too. Okay, so how are we going to diagnose it? History. Physical findings, if they're present. Necropsy, if you happen to do one out there in the field, you'll see muscle is red, dark red to black. It's spongy looking. Looks like it was pumped full of air. It has a sweetish odor to it, and that's true. It does have a sweetish odor to it. I don't know what I could tell you it's like. You just have to smell it. And then you'll have all this numerous bubbles and stuff. How you confirm it is through culture. You have to culture out that bacteria. Or you can do fluorescent antibody testing. Some labs will do that. And some labs actually have PCR available. But if you think you have it if you think you have the spores or an abundance of the spores and stuff in the soil, PCR doesn't work. They basically have to culture it out. And they would do enrichment cultures at that point. Okay, so this is what it looks like. See how spongy that kind of looks? It's like sponge cake. No, I'm just kidding. But it's very spongy. It's got, they say rancid butter. I don't think, when I smelled it, it didn't smell like rancid butter. But in the books it'll say, some of the books it'll say rancid butter. And then all the tissues around it, in between the subcutaneous tissues and stuff, it's almost gelatinous. Reminds you of what? Malignant edema. If you didn't have all that dark tissue, dark muscle tissue, you'd think malignant edema. Okay, another section that can get as dark as this. It's awesome. So what other samples could you take? Let's say you sit there and you get the heebie-jeebies, you're like, oh my God, I'm not going to touch this. So what samples could you take? You can take impression smears, swabs, take some of the fluids, take a biopsy, send it in. Yep. All these things. So, prevention and control of WD. How are we going to do it? What's the big main thing? Vaccination. Following vaccination, farm hygiene. You got animals that are dead and dying, get the carcasses properly disposed of. If you have an outbreak or you have cases occurring in your herd, separate the healthy from the sick. You want to prophylactically treat or give penicillin and stuff to those animals that are susceptible, and those of you who are young or you're old, so that you can prevent the disease in them. But you're also going to vaccinate them too. Wherever you burn or dispose of these carcasses, you want to make sure it is fenced off. Why? Yeah, you don't want other carnivores or scavengers and stuff digging that carcass up. Okay? You know this is in your notes, and actually it's in your notes in more detail. But anyway, that's fine. I don't care. So farm hygiene. We already talked about that. Any questions? Any questions? Okay, we'll go on to the next. Oh, got a question. Yes, I love questions. Yeah, you can say 3 and below. In books and stuff, they'll say about 2 to 3. And the average is actually around 2 to 3 years of age. But it can happen in any animal. Classic, 2 to 3. Ready? You're called out to a cattle farm where you have multiple calves all coming down hill. Some are stiff-gated. Some are lateral with their legs extended, like this little guy here. Owner states they were fine and robust about 3 weeks ago. Actually, he's kind of fuzzy. I don't think he's that robust. When you attempt to go check the heart rate of one of the calves, he goes rigid and falls over. What do you got? Differentials. Tetanus is one. Okay, what's another one? Rabies. What's another one? Rabies. Yeah, okay. But they could also have a meningitis. They could also have some type of abscess or tumor or infection and stuff within the brain cavity or along the brain stem. Okay? You're also silly. Rabies. Okay, here's another one. Can I finish? Oh my God. Okay, you go to a petting zoo, and the owner's upset because her prize ducks are unable to, how does she put it? They're unable to get to their feet, and when they swim, they drown because their head falls into the water. She put them in, this is what happened. The lady took the duck, and he was looking all bad and everything, and she knew ducks like to be in the water, and this one hadn't been around the pond or in the water and all this. So she took him out and she put him in the water and pushed him, and he just kind of went. It was funny, but it wasn't. So anyway, there's several ducks that are affected, and they're varying ages, and people are coming and going and feeding and everything. What is your immediate concern? You got little kids going to petting zoos, and you got the elderly, and some people are in wheelchairs, and some are on oxygen. But this is typical petting zoo. You got people from all ages, all ranges, from everywhere, and they're all feeding and petting these animals. And the way that this lady found out in this particular instance is the little kid saw the duck trying to get around, and it was wobbling, and it fell over, so he picked it up and he brought it to the lady. So what is your immediate concern? Rabies in a duck?
I mean, you never know.
Well, usually it's a mammal type thing, but you're right, you don't know. But what's your immediate concern? Okay, so it's zoonotic, so what's your immediate concern as a veterinarian? Because you're walking out there and there are people still milling all over the place. Right, you got a public health concern. So you need to find out, well, first off, one of the things that you do in that instance or in that type of situation, you talk to the owner and you say, get up all the animals that are sick, kind of pull the ones that are healthy away, and let's cordon off this area, kind of shut this area down, just tell them that, they're getting a little sick and we're going to fix them. Meanwhile, while the owner's doing that, you get on the phone and you talk to who? There's two people you don't talk to. Either the state vet or the public health official. You have to notify these two people. When you have immediate public at risk, then you have to contact those two people. And between them two, they will tell you what you need to do next. Because the public health official is going to require certain type of information, primarily who's involved in all that, so that if they're going to send somebody so that they can talk to these people to prevent the elderly, the immune compromised, and the young from coming down with it. The state vet and along with the public health official, they're going to try to find that source. What caused it. Okay? Okay, botulism and tetanus are both nervous system diseases, and they are non-invasive. True? False? True, because you got it written up there. Okay, but why? Well, okay, botulism. Why is botulism considered non-invasive? It's a toxin. Okay, so why is tetanus considered non-invasive? Same thing, because of the toxin. It's the toxin that causes the problem. Okay? There's no bacterial infection. Not really. It might be localized, but a lot of times it's not. Okay? We'll get into depth about it a little bit later. Why did I put these two together? Because you need to know the difference between the two. You need to be able to identify the one from the other. Tetanus versus botulism. What does tetanus do? It has tetanospasm. Okay? And then you got botulinum. Botulinum. Okay? What's the difference between the two? One is flaccid and one is spastic. Okay. See, there you go. Okay, you'll remember that when you see it. All right. You gonna remember it? I'm telling you. Okay, so tetanospasm, you have tonic muscular contraction. And this tells you why. This is for those folks that want to know all the little detail. I'm not going to ask you that in the test. I'm not Bellamy. And y'all can tell if y'all want to, because I already told her that I was going to tell y'all this. But anyway, because my concern is this. Do you need to know it? you need to know it. You need to know it, you especially need to know it if you're going into public health, if you're gonna be dealing with the public, if you're gonna be dealing with export imports, and if you're going to be on the first line of defense when as far as dealing with disasters and stuff, or you're gonna be a zoo vet. Yes, you need to know. But for routine purposes and real world life situations, whatever you want to call it, when you actually get out there and you start practicing, what you need to know is if he's spastic, you might be dealing with tetanus. Does it matter in your diagnosis why the tetanus is occurring? No. You just need to be able to identify it and put in place measures to prevent other animals from coming down with it, and so that you can educate your own. Okay, all the other stuff is for your edification to feed your brain. All right. Tetanus and botulism found everywhere. The spores are. They're found everywhere. Awesome. They ingest them. All the clostridiums are ingested, they hang out in the body, and they stay there until the appropriate conditions are put in place. Tetanus. Horses and humans are more susceptible than any other species. Pigs, dogs, cats, most resistant to, or less susceptible to. Okay? Poultry, I have not seen tetanus in a poultry or in a bird yet. Not that anybody's diagnosed. Tetanus is more common in the horse. Why? Huh? Does it what? They're always cutting themselves, stepping on things. Yeah, they're more exposed to tetanus than anything. Who else is exposed to tetanus? People. Because we cut ourselves, we step on things, and you get tetanus from a rusty nail. Okay, rusty nail. If I take a whole bunch of rusty nails and I culture each one of them, I'm going to find tetanus. No. So rusty nails and rusty metal does not cause a tetanus, but what it does is all of the rust, the oxidized metal portion, stays into that local wound, keeps it from closing, causes a lot of inflammation and edema to be formed, and you get cell death and anaerobic conditions. So the spores that were brought in by the metal or you being cut or punctured blossom into wondrous, gorgeous bacteria, releasing all the toxins. Okay? That's how it happens. Boy, because if that was the case, anybody that has fillings in their teeth, you could probably come down with tetanus. Depends if they use some sketchy kind of filling. Anyway, horses are not the source of tetanus. It's just that they have ingested more spores than any other animal. What do you got? You go out there, it's frost-covered forage. You find this animal laying there. As you're approaching, it looks dead. What you got? Differential. Tetanus, okay. But it's, okay, here's the thing. When you come in there to look at your case, you look at everything around it, because those are your clues. Clue number one, frost, frozen, covered feet. What should jump to mind? Woo! Because it's been that long. Braxy. Okay, Braxy. Remember, Braxy. You gotta think, you have to look at everything. Remember, you're the detective. You gotta take all these clues, pull them together, and see what you got. Okay, you got all that. So as you're approaching, this is as you're approaching, so you're getting up closer and everything, and then you know, he's alive. So you sit there and you put your hand on him, and he stiffens up again. Now what are you going to add to your differential edge? There you go. And if you notice crepitus around his head, and his facial bones are kind of caved in, what could it be? trauma. Maybe he was kicked in the head by one of his buddies. Okay? So grab all the clues and pull them together before you sit there and go, oh yeah, you got crazy. You go out there and you mess with him. Second thought, he's got tetanus. What's the owner going to think? Exactly. Do you know what you're talking about? Okay, in horses, since we see it a lot in horses, they can present with an extended neck. If they have an extended neck, what do you have to rule out? Choke, respiratory diseases. Or maybe they broke their neck. Who knows? Okay? Or they could have an abscess. Or they could have a broken neck is basically any vertebrae is defined as any vertebrae that is fractured, broken, or dislocated. Broken neck. Oh yeah, I know, but not yet. No, because I thought about that too. I was like, But anyway, so if you got an extended neck, you have to start, as you're walking toward this animal, you've got an extended neck. Maybe his nostrils, you think his nostrils might be flared, but he can't see his nostrils. You need to start thinking, maybe he's got pneumonia, maybe he's got choke, maybe he's got some type of obstruction in his windpipe. See how your differentials come into play. Then you start noticing he's in a sawhorse stance. In other words, his legs are stretched out. Back legs are backed out, front legs are parked out front. What are you going to start thinking now? You still haven't gotten close enough to put your hands on him. Could be what? Bellyache. Colic. Oh, y'all so spicy. I knew y'all could get it. Okay. Now, as you get him closer and everything, you notice that his tail is raised up. What's that an indication of a lot of times? Pain. And if he has bruxism, which this guy is not going to have, we'll find out why. If he has bruxism and raised tail, then you know for sure he's in some kind of pain. He's got stiff muscles. You start noticing his muscles are very, very well defined, and you see that they're stiff, and he's kind of trimming a little bit. So what do you think? Rhabdo. Okay. So you get up there, and you try to get up close to him, and you look at his face, and you see his face is in a grimace. They call it a sardonic smile. You try to open his mouth, and you can't. And the more you start trying to deal with him or work with him, sometimes even when you touch him, they start to stiffen up even more, and then you get this. Prolapsed third eye. Say what? Y'all so nuts. Anyway, so now what do you got? You got tetanus, okay, or most likely tetanus, but it could be still rabies or EPM. Yes?
So that auditory prolapse, third eyelid, is it pathognomonic for?
Pathognomonic for tetanus if they have all the other signs too, but remember, it can also happen in rabies. Okay? Your question.
Did they put that meat in his mouth that you didn't put in his mouth? Or?
No, this guy's hand is there.
Oh.
And he's holding it. No, I thought the same thing because his muzzle is, yeah, no. That's his hand. That's the owner's hand. He's holding the lead rope. Okay, no. Because I was like, yeah, it does look like the nose. Okay, so this is a hand covering the muzzle, holding the lead rope. Okay. No, it's okay. It's good. It's good. This is an old picture from way back when, but this horse has tetanus, and you can actually see he's got the stiff, his tail is kind of raised and out. You can see the muscles are well defined in the front end. We can't really see his face or anything. When they saw that, routinely when they saw that, they would put the animal down. Okay? Because they weren't sure if it was rabies, tetanus, or what. They ain't taking chances. But they can have trismus. What's trismus? I can have trismus too. Involuntary contractions and such. Okay, muscles, usually heavy muscles. If they live long enough to get to your clinic, the owner will tell you the history of them. It's getting worse. It's progressively getting worse, and it will get to the point where these guys will go recumbent, not sternal, but they'll just basically drop over or fall, and they stay there, and some of these guys will go into comas. In pigs, it's not that often that you see it happen in pigs, but when it does, it is so cool from our point of view. For the pig's point of view, it's not. They look like they're walking on their tippy toes. They're walking on their tippy toes, seriously walking on their tippy toes. It's like on the tips of their toes. And if you go over there or you start approaching them, remember pigs don't like to be approached by anybody anyway. They stiffen up and fall over. And those that can will squeal. Okay? And then they have the frothy saliva. And horses can have the frothy saliva too. If you see that, you think rabies. Now, why is it so difficult to open up this horse's mouth? Right, the muscles are affected. They are seriously contracted, holding that mouth shut. Okay? So you don't want to try to force the mouth open. Yes?
So with the normal reflexes, why would they have normal reflexes if the muscles are spastic?
Say what again?
It says they have normal reflexes.
Yeah, they can have normal reflexes earlier on.
Oh, but
Like
there
some
is
of the
something
head
like that.
muscles, depending on where the tetanus lesion is, those muscles will be affected, but the rest of the body and all the reflexes, like before you start seeing head signs and stuff, will be normal. Okay? But as it progresses, then everything is abnormal. Okay, this lady actually, and I was going to get the video, but they took it off of the website. This lady has, what is this first? What is it? Okay, what kind of goat? Is that how they? It's a baby goat. And he has a history of, the owner says that he was fine and he was all over the place, and no, I don't vaccinate him because, it's just my pet goat, he always stays inside. But in the last, he was normal 7 days ago, and about 3 days ago, not even 3 days ago, about 2 days ago, he started having difficulty walking. He's not a Tennessee fainting goat. And she went to get him, and he would get excited, and he would fall over. And this is just showing you, she's holding him. You shouldn't be able to hold a ruminant by the chest and the abdomen, and they be stiff like this. His butt and his back end should actually kind of fold over her hand. And then you notice in the small ruminants, you'll also notice a head tilt. If you see that head tilt before you get to him, what do you think? Head tilt. Could be a vestibular problem, ear infection, could be listeria. And some of these guys can have facial paralysis, the small ruminants. More common in the small ruminants and stuff than it is in the other animals, but you can also see that in both animals. So you have to include listeria on there. And some of these animals have been, it's been, reported that some animals have actually been circulating. So you have to include listeria. So, aspirate, sequela from tetanus. Let's say that people opt for you to treat. First off, you want to see if you can find the wound. If you can find the wound, then you need to go ahead and dose these guys with, if you know it's tetanus, you're going to give them an antitoxin. If you find a wound, make sure the antitoxin is on board as well as penicillin. Make sure all of that is on board at least an hour before you start to debride the wound. Why? Because I can tell you, I can just go through and tell you, this is what you do and everything, but you don't know why. But if you know why, then I know you. If you can explain why, then I know you understand the disease. So why am I, if I'm going, okay, a horse comes in or a goat comes in. Let's say it's a goat. It's a castration site. Castration gone bad. The owner tried to band it. Okay, I think that the source is right there at the banding site. So I want to remove all that biologic tissue, clean it out, flush it and everything. But before I start, I'm going to put tetanus antitoxin on board. And I'm going to drop a catheter and make sure he's got penicillin on board. I mean, I can get it IM, but it takes longer for it to be absorbed IM. I want a high peak when I go in there and cut. So I'm gonna put the penicillin on board. Why am I doing this? What's the antitoxin gonna do? It's gonna tie up all the free toxins. Once the toxin is bound, it's bound until that receptor dies. But since I'm gonna be cutting, I'm gonna be releasing potentially more toxin. So I'm guarding against that. And the penicillin is to keep the bacteria in check. Okay? But sequela, in horses you see aspiration pneumonia, lameness, and myositis. Why do you see myositis in horses if we're treating them for tetanus? What do horses normally do? Every time you see them, they're doing what? They're standing. If they have tetanus, they may become recumbent. And they may be standing when you start the treatment, but they will become recumbent during the treatment. Survival rate, not that good. But if the owners want to, we try. But you're gonna have to give that antitoxin, I think they say 4 times a day for 5 days. Yes?
So you can have cases that they will lay on the ground, stand up, and then like 2 or 3 days later they're just coming.
Yeah, well, with horses, they like what? They have to be standing. That's just the way that they're built. So if they come in the early stages and they're showing mild signs like the muscle fasciculation and the nictitating membranes being prolapsed, but they can still kind of ambulate a little bit, those guys, if they fall down, they will fight to get back up. And if they stand up, they will remain standing. But it'll get to a point where they have no control of their muscles and they will hit the ground and they just lay there. Any animal that has a large amount of muscle, the larger the animal, the worse it is. You have to rotate them from side to side during treatment. Don't forget that. Otherwise, you'll end up with a nasty myositis. And you'll end up with pneumonia in the dependent lung lobe. Yes? Okay, question is can you sling a horse that has tetanus? Oh, you can. Is it effective? Actually, it makes everything worse because the horse has no control over his muscles. And when you get him up, he's fighting to stand. And if he can't get his feet purchased, he's going to fight it. And it's just going to make matters worse. Okay, other things in horses, you can see hypocalcemia tetany, usually grass tetany, acute laminitis, leukoencephalomalacia, cerebrospinal, meningitis, strychnine poison, rhabdomyolysis, HYTB, EMNAD, and myositis. All these things, depending on where you are, depending on where you are and what your experience is going to be reflected in how you bring your differential list together. Let's start with the most common diseases in your area first. Okay? Oh, and there's some more. It just goes on. If it's a young animal, then you think white muscle disease, neurotoxemia, or whatever. But anyway, cattle, here's a whole list for those. And like I said, look, we're saving him. He's protected. All this is in the notes and such, okay? So you don't have to fight if I'm flying through these things. Okay, portal of entry for tetanus. Okay, we're going to start talking about that. We talked a little bit about it, but we're going to talk some more. If mom comes down with tetanus and baby has been nursing, is baby at risk? He's at risk. Now, why? Because the toxin, depending on where that wound is, or how close that wound is, that has all that toxin being released, how close it is to the udder is going to determine whether or not baby's going to be infected too. So we don't take any chances, we treat them both. And the way we treat the babies is we give them antitoxin, but we also put them on plasma, hyper-immunized plasma. And I'm over time. I don't think that was enough on Clostridium. I'll let you guys finish up the rest of them. Like I said, everything is in your notes and all. And what I'll do is to keep things kind of going and try to point out key things so that you get an idea of what to look for and how to study. I'll start with sticky literacy. That's quick and fun. It's got lots of pictures. I like pictures.